Good morning, good afternoon, and if you guys feel sleepy during my presentation, good night. I have 13 months of US clinical experience with IM, FM, cardiology, and hemonc with inpatient and outpatient. I'm gonna differentiate the types of rotation, where to do it, when to do it, and how can you find it? It's the main question. So, okay. You will require around 3 to 4 rotations. People nowadays do a lot of rotations. Three is the minimum because sometimes you don't have time before applying. So you only have like 3 months, go for 3 months, and the one is you can use your home country LOR. It's fine. So go for three. Hello? Yes? Okay. So rotation goes on parallel with the LOR. LOR is like one of the most important portion of your CV, which you can handle, you can change, and you can work on it. It depends on your dedication and work in the rotation. So I will also explain what type of LOR which is important with the rotation. And you should go with the strategic planning that you want to go for IM, go for an IM rotation. Like I've seen people going around, they got some PEDS rotation somewhere. They'll just go for PEDS. But at the end, the program specifies that they need at least 2 LOR or 3 LOR from specialty and one from outside is okay. Nowadays, everyone applying with more than 4 rotations in just IM or PEDS or psychiatry. So you should go for strategic planning in just IM or FM in your specific specialty. So what are the type of rotations? I've seen this is very basic information, but I've seen people around the world, they lack of knowledge regarding it. So inpatient rotation, which is the highest value, which we say is like wards or ICU, is the highest value. Outpatient is OPD or outpatient department, and there are rotation which provides inpatient and outpatient both together. But the inpatient has the highest value. Then comes the inpatient outpatient together, and at the last is outpatient. So when to do it, like it's called differently electives when you do it during internship, which has the highest value. You are allowed to touch the patient, and other than that, if you do it after internship, it's called externship of observership. Observership is just you observe a doctor, you don't do anything. But in externship, you it's called hands-on. You're allowed to touch patients in a way like just for vitals, or you're allowed to do EMR, which is good for your CV. Hands-on rotation LOR is good for your CV. Okay. Now, type of hospital, they are mainly divided into three: university hospital, community hospital, and private hospital. University hospital, if you do rotation over there, it has the highest value, very competitive to get in, and it might cost you a lot. And then comes the community hospital, and at last the private clinics, which is very easy to access, and a lot of people go around here. So if you're targeting something different from your competitors, you should target university hospitals or community hospitals. University hospitals examples are UAB, University of Alabama, University of Florida, University of Miami, John Hopkins, University of San Diego. These are the high-end uh, university hospitals where you can get in, and I've seen people doing rotations over there. It's if university letterhead comes on your CV, it's one step ahead because people know that this is authentic. Even while getting in recruitment for the physicians uh, as an inpatient or outpatient physician in university hospital, they require a lot of stuff. So if someone with that level of knowledge writing your letter pushes your CV a lot ahead. So Now comes the LOR thing, which goes parallel with the hospitals. University letterhead it's most prestigious and most impactful, as I say. Then comes the community hospital. Uh, I will let you know how to find these things. And there comes the private clinic where you work with a doctor, but the doctor is affiliated to some hospital. So they might give you a university letterhead or community hospital letterhead, which is good. And at the end comes the private clinic letterhead. It goes in a way, university has the highest value, community second, the private clinic with the hospital letterhead comes the third, and private clinic letterhead is comes at least. Okay. So when to do it? You guys should. So people do require it within 1 to 2 years of your application. Application starts if you consider the next cycle, September 2026. So they ask you to do rotations within last 1 or 2 years. Some of the programs specifically ask for last 6 months of rotation, that it has the highest value. So if someone goes like 2 years back, they did rotation, they come back, but things are different now. Knowledge is different right now. You've been apart from your medical field for like since 2 years. You don't know, you don't have the clinical exposure to like wards or to patients. So they want a recent letter with your recent knowledge and or recent capacity, how you treat or how you take care of the patient. So 6 months is the best time. Last 6 months is best time. But if you don't have time, if you've done it previously, it's fine. But try to focus it within 2 years. I've seen people doing rotations in like internship, and then they go applying after 4 years. The value is very less, but it's better than nothing. If you have time, if you're going there to meet your brother, sister, or you have someone around, uh, or a trip and you got some time around to do some rotation, you can do it. It's a plus for your CV. Then what's the important for the LOR quality? LOR quality, if the preceptor or the physician writes it, it's the best. It has all 5 stars from my side or from a program director side. Then comes that you write it and the preceptor reviews it. There are so many rotations around there. The physician's obviously gonna be busy. He is not gonna if he provides like 10 students a month, so it's 120 students at the end of a year. They might not be so free to write each and every aspect for a different student. So they ask you to write it for them and then they review it. It comes on the second, top second. Like the top is the doctor or physician writes it by himself. And the last is the generic, which I call fill in the blank LORs. You guys should try to avoid it, but it's better than nothing. If you are not getting anywhere else, try to get this. Fill in the blank is a doctor has a format, and the doctors only fill your name or a patient uh, you encountered with or you did a presentation with. They just fill the things up. Everything else is same. So nowadays the faculty are starting to know this thing and they are trying to avoid this kind of rotations. Like they want to know something from your side, that what you are sharp into or you are your caliber or your potential, specific, how you treat patients. They want to know specific things, which is more important. Okay. So when to do it? It comes from January to May, not just May. Start finding options because a lot of programs they do take like 3 4 months for approval. If you go for university program, I know that UAB like fills up within 6 months to 1 year before doing the rotations. University of Florida is the same. So try to look for it like 6 months apart. Then goes for like so September is the application time. You have 3 to 4 months. 4 months if you need all four LOR. Go for June, July, August, and September. September in a way that when you apply and you're rotating somewhere, they might vouch for you that I know this guy. He is working with me. He is doing rotation with me right now. His knowledge is exceptional, and the way of treating patient is exceptional. They are not expecting things from you to know everything right now. They're expecting a polite nature that an easy to blend in nature, that they can work with you, they can teach you, and you can take it easily. So in September, August, September, it's very good. They remember you that, oh, this guy was there last month, and you apply. There are high chance of getting you an interview from that place if you do it in September. And if you have money and is possible to stay more, you can do it in October as well. So during the med cycle started after you submit the application, you can work with a doctor, you can ask them, request them to push you or just review the application. And if they like it, they might give you an interview at the end. So I would recommend to start from June to October and would recommend to plan everything before going to US because nowadays, because of the visa issues and everything, they ask you where you're going. They don't want any gaps in between. So try to connect all 4 months or 5 months with it and don't stay any month or any few days, like more than like 15 days is fine if you are traveling around. But I would say don't stay more than 15 days without doing nothing over there. Some people go there and they are like, okay, I will find something and they might find something nearby, they're gonna do it. But because of the recent issues, I would say try to avoid that scenario. And so last year rotations are acceptable. Try to do it in last 6 months. And yes, if you have less time, you can do a dual rotation. I have done it as well. It's good if you have less time for say like someone gave like step two and OIT over here, they're gonna start July, August, September. But you can find a dual rotation over here, like two physicians are ready to give you LOR. Like one day you work with the other guy, the other day you work with the other guy. Then they might provide you two LORs in a same rotation. So if you have less time, try to do dual rotation. But if not, if you have like couple of months with you extra time, don't go for dual rotation. Dual rotation is like you're doing half work. Not every day you're not going with a doctor. So the program director says that you work with a physician for 30 days. It's very less to know a person. Still, it's acceptable. But when you work with a physician for only 15 days, how much they can know you? It's very less than the actual time. So they might go with the 30 days. Try to go with the 30 days, but if you have less time, you can go with dual rotation. There's a myth. There are a lot of myths around. Free rotations are bad and costly rotations are good. No, it's totally opposite. If you find something by yourself, someone's ready to give you free rotation, they might be good. And even costliest rotations are bad because like in rotation itself, you're gonna learn a lot. It's nothing bad about rotation, but the rotation goes along with the LOR. The LOR is kind of generic or some other issue, or it doesn't go up on time because doctor's so busy, he might not upload it on time. With the application season, it takes like 15 days to get uploaded over there. So you might not get on time. So try to get reviews around and then pay the money. Some people think that costly at the rotation, it's good. No, it's not like that. Okay. For rotation, where to book it? Try to do it in an IMG friendly state. So your chances of getting match increases. You can book it with a friend because the cost gets shared. Like you can, with the staying, with the food, with the transport, you can share the cost. It decreases, and you do it in a residency program which is IMG friendly, which gives visa, and you might have a chance of getting an interview from there. This is the main slide for today. This is the way you find rotations. The first one is the official website. So it comes with a great power like this. First one is the most effective way, then comes the second, third, fourth, fifth, and the sixth one. Agencies goes at the last resort. Okay. The first one is the official website. You go on official website, you check for the requirements. Someone wrote that one of the program asks for the ECFMG certified. How can they go for it? ECFMG certified you can only be after step two. So try to find some program which is not requiring that, or you may email them that I'm this student, have given my step one or come from this state and so, and want to do rotation with you guys and have not planned step two yet. So can you provide me a rotation? Sometimes they might have some slot empty. Like you see in winters, it's snow and the people not coming over there. So they might go for it. Like it's fine. They're there to teach you. They're there to help you. So if there's a spot available, you might get one. They say that we recommend a person having this certificate or this step, but it's not always must. So official sites for university, community programs, and uh, and the private clinics as well. Okay. So university, I know people doing rotations with UAB, San Diego, John Hopkins, Miami, South Florida, and John Hopkins, Yale, yeah, and community hospital, a lot of them, like St. Mary in Pennsylvania, St. Mary St. Clair in Jersey, Geisinger. I did in Geisinger, which is in Pennsylvania, right center. It's in Pennsylvania. There's one MedStar in Maryland. So there are a couple of them. Go to their website, try to connect with them. The second comes is the personal contact. I believe a lot of people are gonna get rotations from there, and which is very important. Like you can directly connect to your friends and get the LOR at the end. If there's some issue on their side, you can directly connect to them. So personal contacts goes in a friends like your senior, your colleagues, your junior, getting match over there. Ask them if they know someone. They can help to get a rotation over there, or they might know someone because like right now uh, and a lot of my friends, I can ask them that my brother or sister wants to do a rotation. Can your program provides it or not? Second one, if you guys come from a non-medical family, you guys can go for professors. You can ask your med school professors that can you guys help me because their friends, their colleagues might be somewhere. They might help you with it. Even I did had all my rotations, but I did get connected to one of my professor's friend, and he was ready to give me a rotation. So that's one of the other point. Ask them where are they, and this all rotations and LOR like a private clinic, but the person knows you is better than a generic LOR, even if it's a it's a private letterhead. So try to go for a person who knows you and who can write you, who can vouch for you. Sometimes the program knows some guy. They might call them that I see your LOR over here. Do you know this guy? And if you're done specifically with a connection and went there, they might know, like, yeah, I know this and this. I know Mr. Kumar. Yeah, he was there with 2 months with me. So it's very important that way. Then family connections, your parents might be in a medical field or they know someone out there. Um, So try to connect with them. They might help you getting connected to someone else, and you can do rotations. Any person in US, every person in US has a PCP, primary care physician, for them. They can ask them that he or she is my brother, sister, or my friend. Can you provide or help him with the rotation? I've seen one of my friend didn't had any connection, but the sister was there. So she asked the primary care physician, "Can you provide my brother rotation?" And he said yes, and he got at the end he got the LOR and he matched at the end. I also know a friend who they had a business, and the next door doctor, next door was a doctor. They did connect and help the student to do a rotation over there. So ask friends, family, anyone who is in US, you can ask and knock their doors. Then comes the cold emailing. You can cold email everyone, and like university programs, there are a lot of doctors around there, a lot of physicians. Just email them. They might be, if they are free, they might give you a rotation. Try to include all of your achievements. If you got gold medals in your med school, try to highlight it in your CV or in your emailing that okay, I've done this. If you're given step one and step two, try to highlight it. If you are looking, if you are emailing, cold emailing someone from the gastro department of Mayo Clinic, then, and if you have done some research regarding gastro, try to highlight it. If you have done research with some bigger doctor who is in cardio or who is somewhere who is from Mayo Clinic, you can highlight it over there that I am this given step this, and I worked with this doctor and I'm interested in gastro. So I want to do rotation with you. And because of my interests, I did this research, this. They might read the research, they might like it, and they might offer you a rotation. So that's the third thing, how to write email. You can absolutely take help of ChatGPT. It helps you a lot, but try to fill in and don't hide. Like people are shy, they don't want to show their things up. They score to 17 step two. Show it. If you show it, they want everyone wants their student to highlight. If someone if you talk about me, if there is a student who is 270 and I send it somewhere, I'm gonna be proud that oh that student's doing great over there, and their program director is gonna say that okay, the guy you recommended is doing great. Thank you. Then comes the conferences. You go to US-based conferences, try to make friends. A lot of physicians come there. They are all academically active. Go them, talk to them, take their emails, take their messages, text them, email them that we met over this, and I want to do a rotation. I'm interested in this. I'm sorry, interested in neurology, interested in psychiatry, and we met over here. So they might know it. Yeah, I know this guy, and they might provide you even 7 days rotation. One professor asked me that okay, so I did a presentation. Try to do a presentation. They might know you with the presentation that okay, this presentation, I know this guy. So a doctor did give me 7 days of rotation over there, and at the end it end up for a month. He did that time for 7 days, and then I went there, and the plan changed, and he gave me a 1 month rotation. So main four things completed: official website, then personal contact is the main thing. Personal contact is the main thing because when you apply, the physician's gonna get so many emails that please upload my letter, please upload my letter. He is busy. He's gonna upload everything at the end. But from our side, you're gonna be curious. But if you know someone that you know that he's gonna stand there, he's gonna help you at the end. So The curiosity, the nervousness, and the headaches are less. Cold emailing, as I said, try to write a good email, and you might end up getting sick. Conferences, do a presentation. They might know you, they might remember you, and you might get an rotation. Then comes the LinkedIn and Reddit. It's the social media thing. LinkedIn nowadays, everyone posts all the things online. So you might check on the LinkedIn profile that where they did the rotation. If you see some program over there which gives the visa and which is nearby your area or your family lives by there, you can email them that I want to do a rotation over there, like cold emailing. But cold emailing from LinkedIn is like specific. Uh, you email, you make a list. You know a few students doing rotation over there. Your friends there, go to their profile, make a list that oh they did this. They already did the rotation over there, so they are giving rotations. Now you email them, they have spots, they can give it to you. Then you can go to the students who already matched, who are PGY1, PGY2. You go to their profile and you see where they did the rotation. You check it, you make the list, and you ask them. They already matched, so the LOR was good. There were less flaws than other things. So you email them, you ask your friend, so personal contact comes with the PGY 1, 2, and 3 as well. You directly ask them if their program provides the rotation. If their program provides you a rotation, it's very plus because they will know you doing rotation there. They will know your knowledge and way of working. And when they give you an interview, it's not sure. Nothing is surety. But if you get an interview from there, there is someone there out there to vouch for you. They will say that I know this guy from 10 years and you just know it for 1 month, but since 10 years, it's good. So the thing, Reddit, LinkedIn and Reddit goes for reviews. Check the reviews for the rotation. Not every review is perfect because your aspect and my perspective can be different, will be different for sure. If you consider my rotation, one of my rotation, people didn't like it because they used to give us to talk to the front desk, to talk to the patients, like on call. People didn't used to like it that why are we doing the staff work? But I personally liked it because I was nervous at start. My English was not that strong. The accent they speak is a little different, but which made me a little more confident. So the reviews, try to read it, but then go and ask your friend who did a rotation over there. That is it true? How's your experience at the end? And then message them booking. Last thing is the agencies. I would say agency, they're good. They provide you rotation. It's very easy. You get in. But a lot of time things happen is the LORs might be generic. Um, it's not assured, but it happens a lot of times. I did learn a lot from this agency rotations as well, but would say keep it last. If you don't get any rotation at the end, do it because you want at least 4 LORs at the end. The main goal is to match. So go for it. So with the official websites or personal contact or cold emailing, you might find free rotations. With the agencies, it's costly. So these are the main things for today's lecture. Then these are the tips of after your rotations, which is very needed. And goal is to match. The tip is like stay connected to the preceptor or the physician. Take photos with them and keep emailing or call or text. Like if there is the doctor's birthday, you can send him a message. Stay in touch is if you are in the same town again, go and meet the doctor. They will remember you. Doctor has so many patients, so many students around. even forget you. So stay in touch with them whenever you have chance. Go and meet them. Don't specially take a flight and go there, but if you did rotation in New York, you are in New York, just take few hours to meet the doctor. They will like it. They will remember you. Pictures because they might forget you. One of my friend did a rotation and the preceptor died. But the preceptor's daughter, who is a physician, she was ready to give the LORs for the students who did it. But for that, you need a proof that you did a rotation. So photos can help you in a lot of ways. And you can even send them back the photo which that, oh doctor, you remember that I'm this and I'm applying this here and this so and so. Text and all, send them happy birthday, and like don't text them a lot because they are busy, but you can still here and there, like if you're published a good research, send them email that I this, or if there is a birthday or a big festival, you can share it with them. Okay, that's the whole slides. You can follow me on Match Miles. You can DM me, and for more information, you can go for Program Insider. And they have a lot of things like other than rotations. They have interview prep and the application prep, everything.